Hello everyone, today we are going to discuss about the topic pancreas. So firstly, we'll start with its location. It starts from the epigastrum region and extends to the left hypochondrium region. And it originates from the T12 level to the L3. And about its dimension, it weighs for about 80 to 90 gram. Its thickness is of 1.5 to 2 centimeter. Its widthness is 3 to 4 centimeter and its length about 12 to 15 centimeter. About its parts, it has 4 parts: head, body, neck and tail, in which head is a process of Unisett process and body is tuber omented. Now we'll talk about the relations over here. As you all can see, in A part, this is inferior vena cava, B is our common hepatic artery, C is our aorta, D is celiac trunk, and if we talk about E, it is our splenic artery, F is our left spleen, and G is our left suprarenal gland or adrenal gland, H is our left kidney, I is our splenic colon flexure, J is our superior mesenteric artery, K is our superior mesenteric vein, and then our L is our duodenal jejunal flexure. Now further, we'll talk about parts and its relation. Starting with the head region of pancreas, it has mainly 3 borders: superior, inferior and lateral. Superior border is the first part of duodenum, inferior border is the third part of duodenum, and lateral part is the second part of duodenum. About its surfaces, it consists of 2 surfaces. First is anterior and then second is posterior. Our anterior surface forms the transverse colon and mesocolon part, and the posterior surface consists of the inferior vena cava and common bile duct. Second part is a neck part. If we talk about the neck part, it consists of 2 borders. First is superior border, second is inferior border. Superior border is formed by the duodenum part and inferior border is formed by the head of the pancreas. If we talk about its surfaces, it has 2 surfaces: inferior surface and posterior surface. Inferior surface consists it is formed by the pylorus of stomach, and the posterior surface is formed by the portal vein or infraduodenal vein. Further, we'll talk about the body part. Body part consists of 3 borders: superior, posterior and anterior. Anterior is the transverse mesocolon. If we talk about its surfaces, it has 3 surfaces. First is anterior, inferior and posterior. If we talk about its supplies, anterior has the celiac trunk, common hepatic artery, splenic artery, lesser sac and stomach. If we talk about the inferior side, inferior surface, then it consists of superior mesenteric artery, superior mesenteric vein, duodenal jejunal flexure and splenic flexure of colon. If we talk about its posterior part, then it consists of splenic vein, superior mesenteric artery, aorta, left kidney and left suprarenal glands. Further, if we talk about its tail region, then it is the only peritoneal part, which is its lienorenal ligament. It is the mobile part, which is mobile during splenectomy, and it has the largest collection of islets of Langerhans, which needs to be conserved during splenectomy. Further, we talk about its duct. It has 2 types of duct. First is the main pancreatic duct of Wirsing. It connects it or joins with the bile duct and it opens into the major duodenal papillae, which is 10 cm from the pylorus. Second type is the accessory pancreatic duct or duct of Wirsing. Duct of serotonin. In this, if we talk about, so it joins with the minor duodenal papillae and it lies 2 cm proximal from the main pancreatic duct and 8 cm from the pylorus. Further, this is the last, we are going to talk about its arterial, venous and nerve supply. If we talk about its arterial supply, so it originates from the celiac trunk, gets divided into 2 parts. First is common hepatic artery and the second is splenic artery. Splenic artery is the main supply to pancreas. It has 3 sub-branches. First is arteria pancreatica caudae, second is arteria pancreatica magna, and third is dorsal pancreatic artery. Now, moving further, if we talk about common hepatic artery, it is divided into two parts. First is proper hepatic artery and second is our gastroduodenal artery. Gastroduodenal artery is further divided into superior pancreatic artery, which has two divisions. One is posterior division and second is anterior division. Now we have in this one structure called as superior mesenteric artery, which is the inferior pancreatic artery part. Now if we'll talk about its venous drainage, so it is done by three veins: portal vein, superior mesenteric vein and splenic vein. Further moving on, the last thing that we are going to talk about is its nerve supply. It has two supplies, parasympathetic and sympathetic. Sympathetic is done by the
T6 to T10
part and parasympathetic is done by the right vagus nerve or posterior vagal trunk. Thank you.